Good afternoon. Mine is titled To See or Not to See, except we're not on the right slide. Oh, it's not. Oh, there it is. Yes, we are. And what I want you to do this afternoon, I'm changing up a little bit, is if you feel safe to do so, I want you to close your eyes. And I'm going to ask you to think about some things. With your eyes closed, I want you to think about your surroundings, and I want you to think about where are the exits in relation to where I'm sitting right now, okay? How many people are around me, and how many people would I have to pass by to get out to that exit? What are the colors of this room, and is there carpet on the floor? And where did you park the car? Okay. Now, when you think about where did you park the car, it's like all of a sudden there's this picture that kind of comes to mind as to where that car is parked, because you know you park the car and you always have to remember where you parked it. So you count rows, or you're looking for that light, or you're seeing that tree. And those things are important because it's kind of like how we're going to get home. We have to know where the exit is. We have to know where the car is. Okay. You can open up your eyes if you would like. There are some things, though, that maybe we weren't really consciously aware of, like the colors in this room. What does it matter what color the room is, unless it really shouts out at you? If there's carpet on the floor, again, it's like, does that really matter if there's carpet on the floor? But then it does matter. Were there stairs when you came into this room? And if you've been in this room a lot of times, then you know, yeah, there are stairs. But if I asked you how many stairs were there, you might have to stop and think a minute, okay? And did you come up a curb when you walked into this room? And how did you know that curb was there? Was it yellow? Was it just plain? Okay, the more aware we are of our environment, the safer we can make ourselves, because we have this mental picture of some of the obstacles we're going to face and what we're going to need to overcome to maneuver between here and our car and even home safely. So now back to the format here. Over time, change occurs. Does everybody agree change occurs? Yeah. We all know that change occurs. Some of those changes are physical. We're less mobile, less flexible, less strong. Some of those changes are sensory. You know, we don't feel things quite like we used to, and some of those changes are cognitive. We don't remember things as well as we used to. The first thing we need to accept is, yes, there are changes. And the second thing we need to identify is, what are those changes? Because if we refuse to believe a change has occurred, we're not going to do anything to protect ourselves, so to speak. So if I refused to believe my eyes had changed and I didn't have glasses on, I would really have a hard time reading and seeing the computer screen. But I recognize that, yes, things have changed and I do need to wear these glasses. Once you've identified the change, then the next step is to identify, well, what do I need to do to make sure that I can do the things that I need to do? So I wear my glasses. I might not wear high heels anymore. I might wear flat shoes. I might wear shoes that only tie so that they stay on my feet versus shoes that are clogs that can slip off my feet at any time, or might cause me to trip because they don't quite come up as high as my foot does. Sorry, guys. I'm losing my place. I should have just read it to begin with, and then I wouldn't be losing my place here. So, we're going to talk about safety and how to prevent falls. Balance, which is basically what we lose when we fall, is our balance, correct? It's made up of, I like to think of it as a three-legged stool, okay? So one of those legs is vision. One of those legs is our sensory system, and one of those legs is our vestibular system. If you were to take a stool and cut off a little bit of a leg, your stool now becomes a little bit tipsy, right? You could probably still sit on it because you know that it's a little bit tipsy, and you kind of adjust your weight so that you can sit on it. And if you cut off a little bit of two of the legs, well, you still might be able to sit on it, but you know you're putting yourself at greater risk because now two of those legs have been cut a little bit short. So if you look at it from a human perspective, if we now have numbness in our feet because we're diabetic or because we have some form of neuropathy, our balance is going to be a little bit impaired. If we have changes in vision, again, our balance is going to be a little bit impaired. And so in recognizing those things, those changes, we need to accommodate to them somewhat. The sensory system basically allows us to identify if our feet are on the ground, what kind of surface we're standing on. Is it even? Is it flat? Is it rough? Do I need to move slower because I could twist my ankle, I might fall? There's also joint sense in terms of when we move, and position sense when we're standing still. Changes in sensation or an inability to feel can compromise our balance and place us at greater risk for falls. The vestibular system is something we're going to be hearing more about later from Paul, but it helps us to orient ourselves in space. It tells us if we're upright, it tells us if we're leaning, it just gives us feedback about ourselves. Problems with the vestibular system can lead to dizziness, nausea, and make changing from one position to another difficult. That's all I'm going to say about the vestibular system because Paul does a way better job than I do. The visual system, we're going to focus more on that because that's one of the things that we actually do treatment with in occupational therapy. Visual changes usually mean a visit to the eye doctor, and we've all been to the eye doctor, and we know that we need help if we have difficulty reading, if we have trouble seeing distance. We get these glasses to help us see better. Vision changes can be subtle and also contribute towards falls. You might be at low risk for fall if you have good vision in both eyes. You could be at risk. You may be at moderate risk for falls if you have good vision in one eye and moderate or poor vision in the other eye. Research has shown that although the ability to see is a fair predictor of falls, other visual functions required for maintaining balance and detecting hazards are the ability to see depth perception and the ability to see contrast. Now, depth perception and contrast actually goes hand in hand. And the best example of that is curbs. If you can't see that the curb is there, you might trip on it. If you can't see the curb is there and you're having difficulty seeing depth, when you take that step, you may stumble because it was down further than you expected it to be. And I think at all stages of life, we've all had that feeling of, because the ground wasn't where we thought it would be, and we are now having to catch ourselves. When we're younger, we catch ourselves much more easily than when we're older. And I have had many opportunities to practice that myself, so I do recognize there is a difference. Impaired depth perception is the strongest risk factor for multiple falls. Environmental obstacles or hazards which may occur and affect or give an impaired depth perception include the ability to see steps and curbs, transitioning between a carpeted surface and a tiled surface, stepping up onto and or over a surface like a tub or a shower, stepping over or around booths, dining room tables, etc., and navigating through narrow passages or crowded environments. The ability to see and anticipate these obstacles and the ability to determine how to negotiate it will help us to avoid falls. So we've got to see it, and then we've got to plan for it. If we're in a hurry, we may not see it, And if we don't see it, we're not going to plan for it. And then we may either be bumping into things inadvertently or potentially tripping over things, and we may experience a fall. Right next to that is contrast sensitivity. Contrast sensitivity diminishes as we get older, and it's the ability to see things when there is little contrast. And so up here at these stairs, and I don't know if you can really see the stairs, they put that black kind of line to indicate there's a stair. They put that black line, it's a good thing because that's of greater contrast. It's easy to see the chairs in this room because the chairs contrast with the carpet. So there are lots of examples where contrast is good, and then there are other examples where contrast isn't so good. So for example, those doors on that far wall, they're the same color as the wall. If it wasn't for those windows in the door, we might not recognize that as being an exit or a door. The ability to detect objects is improved when there's a high level of contrast. When there's low level contrast, it would be like walking around in the dark, is an example of low level contrast. The ability to see a menu at a restaurant, and a lot of that depends on the lighting in the restaurant. Locating a medication or a pill when it's placed on an object of similar color or on a tablecloth with a busy pattern. And so it doesn't even require that things be the same color. It can just be that there's enough busyness or distractions going on that you can't find the thing that you dropped. Environmental obstacles and hazards that place us at risk because of diminished contrast include spills on the tile, like water on the floor. Water, you just don't see it right away. Dark doorways, and the doors in my house are dark, and I cannot tell at night if they are opened or closed, and it sounds so silly that I can't tell if a door is opened or closed at night. But there isn't enough light for me to determine if it is opened or closed, and I've learned you put your hand up, make sure it's open before you walk through it. Pouring coffee into a dark cup or milk into a white glass is another example of when you might have difficulty performing the task because you can't see the contrast. The other thing that can happen is if you're in a room that's got bright lights and now you're walking into a dark room, it's like, wait a minute, can't see. And that especially happens at night if you get up to go to the bathroom and now you're leaving a lit room to a dark space. It takes a while for the eyes to accommodate. So, another factor to keep in mind is that regular wearers of multifocal lenses have greater difficulty detecting depth. Now, I don't know if you've heard it, but when I first got my first pair of bifocals, the doctor or someone told me, don't look down. They said, don't look down because the reading lens distorts the depth perception. And I am pretty much convinced that because I've been told not to look down and I don't look down, that I'm running into a lot more things because I'm just not seeing it. And perhaps it's because I'm walking too quickly, that I'm not giving myself time to see what's in my way to avoid it and to circumvent it. But I still haven't quite learned that trick. I'm still running into things. But it is something I definitely should work on. It says regular wear of multifocal lenses are more than twice as likely to fall outside their homes or when negotiating stairs. I don't look down at the stairs when I'm walking down them. I was told don't look down at the stairs when you're walking down them if you have your glasses on. That is why handrails are so much more important. And that is why, thank goodness, physically I can't gallop up and down the stairs like I used to. I have to take my time, which gives me an opportunity to maneuver the stairs without a fear of falling, since I'm not looking down at them. The next part I'm going to talk about is home safety and fall prevention, and these are things that are pretty common sense and you've probably already implemented in your homes. You want to remove throw rugs and make sure your carpets are secured on the floor. Having handrails or grab bars at entryways to homes, especially if there's stairs, in the bathroom, around the toilet, around the tub, and anywhere you might experience a sense of dizziness when getting up. And oftentimes when people get up out of bed, there's that sense of dizziness, and that's potentially a good place to have something to hold on to, just to kind of right yourself until you've got your land legs. Keep items you frequently use within reach and in sight. When you're looking into cupboards, whether it's upper cupboards or lower cupboards, step back and see if you can spot the item that you're looking for. Looking up high or bending down low can sometimes cause individuals to lose balance. And so by stepping back, you can see what it is you're looking for, and you can make a plan as to how you're going to get it. Make sure spills are cleaned up and leave a marker if necessary. So if by chance you spilled some water and you've got to go get a towel, but you know that when you come back you might not see where you spilled it, is drop something on the floor so that you can make sure you can find it when you come back. And keep a phone or other device accessible at all times to call for help. Other things to keep in mind is removing clutter, especially if you ever had to use a walker through your house and your house has got clutter. It becomes very difficult to manage a walker if you needed to. Remove cords that might extend into pathways, and make sure your pathways are always open. Keep pathways well lit, especially at night, including hallways, walkways, bathrooms, etc. And if you do have to get up at night and you do have a sense of urgency and you do have a fear of falls, you might consider some of the alternatives, which would be like using Depends or having a commode close by, if that's really an issue. Other factors to consider is participating in regular physical exercise. Individuals who have stopped doing daily activities or exercise are at greater risk for falls than those who are active. Have your hearing tested. Hearing is closely associated with balance. Have your feet problems treated. Do not get in a hurry. There is nothing that I can think of that we really need to be in a hurry to do. If the phone rings, they can leave a message if you can't get there in time. You know, I just have a hard time. Maybe if there's a fire, yeah, let's hurry and get out of the house. But there really are very few, if any, reasons to get in a hurry. Know your medications and the medication side effects, because medications can have side effects that might put you at greater risk of falls. And wear shoes that provide good support. I'm going to introduce Paul next. Paul is a physical therapist at the Healthplex.
Good afternoon. So, for those of you who are able and desire it, please stand up for a moment. Everybody wave their hand, and now let's switch sides and wave the other hand. Everybody take a deep breath, but not too deep, no hyperventilating, and slowly let it out. And then, if you guys want to do the twist, you can do the twist. Or if not, we can all just sit down, except for me. Okay, balance, how it works. So there's an inner ear vestibular system. So when we say ear, we're not talking about the hearing part now, but a part that's very closely located to that. With the utricle, the saccule, and the semicircular canals, none of which will be on the test. That's good, because you couldn't hear, right? Okay. And as has already been mentioned, vision is another important balance factor, and proprioception. And of course, to control all those things and modulate it and combine them together into balance, it takes the brain, right? And then the brain sends information down to the muscles, because you can know you're falling, but if you can't take that step, you can still be in trouble. So there's a diagram of the vestibular system, and down at the bottom, there's kind of a little snail-like thing on the left. That's the hearing part. The rest of that is all the balance part. And there won't be a test on that either. But it's interesting that that whole thing fits inside of the red eraser on the end of a number 2 pencil, assuming that that was hollow, and you have one on each side. Dizziness and imbalance problems. Well, there's a whole list of things. Dizziness, unfortunately, is a very common symptom and can cause a lot of problems. BPPV, which is benign paroxysmal positional vertigo, commonly known nowadays that we have the internet as the crystals problem. So people report to me and they say, I've been told I have rocks in my head. Truthfully, we all have those rocks in our head, but it's just when they get loose and go into the wrong place that causes a problem. So other problems with the vestibular system, peripheral, and then when we say central vestibular, we're talking about the brain, really. And then musculoskeletal problems. Again, if you can't take that step, that can be an issue for balance. Many drugs, prescription or otherwise, can cause a problem. So let's talk about the benign paroxysmal positional vertigo a little bit, the crystals. They're part of the sensory organ, either the utricle or the saccule, and when they escape, they get off of a mucous membrane in there and they float through the fluid, which communicates with the canals and gets into the semicircular canals. It causes malfunction of the canals. And a lot of times, the fix for that is pretty simple. We can reposition those crystals and send them back there. So if you get BPPV, it can be very, very strong symptoms and can really affect your balance, but sometimes can be fixed pretty easily. Other peripheral vestibular problems are something affecting the nerve that goes to that. So a neuronitis or a labyrinthitis. Labyrinthitis refers to the actual sensory organs themselves. An acoustic neuroma, which is basically a growth can occur and affect that nerve. There's a disease called Meniere's where it affects usually one side but can affect both sides. And then trauma. You know, if you get hit in the head, you could have brain damage, or you could have skull damage, or you could have inner ear damage. And there's a host of other diseases which can affect the ear. Let's just cover a couple quickly now. The central vestibular problems. So tumors, either cancerous or benign, can affect that nerve or one of the other centers in the brain that process either the sensory information for balance or the production of balance using the muscles to get yourself back on track. So concussion, or the sequelae after a concussion, which we call post-concussion syndrome, can affect your balance, can cause dizziness. And then there's stroke, there's migraine, there's various neurological diseases like Alzheimer's, Parkinson's, multiple sclerosis, and others, unfortunately, all of which can have this problem kind of along with it. Going on to musculoskeletal problems or peripheral nerve problems, if you have poor strength, poor muscle control, or a sensation difficulty, that can make it difficult for you to maintain your balance. Even just poor range of motion. If you've ever heard of somebody who has foot drop, their foot just doesn't lift up as well as it used to, that can cause a balance problem. You can trip over your own foot. Some of us, myself included, can trip over our own feet anyway. I can remember one time, don't do this, okay? I can remember one time I was working under the aegis of the Army, and I was at a training facility, and I'd never been there before. I had to run back to my hotel room, and I was literally doing that, running back to my hotel room to get a paper. And there was a series of 3 steps, and then about 3 feet later, there was a little tiny 1-inch step, which I never saw. Guess which step my toe caught? So Deb was talking about, you know, you have to see it, kind of to avoid it. Well, I saw the 3 steps, the big steps. I had no problem. I ran right up the steps and tripped on that little 1-inch one. I fell flat. Fortunately, I was not injured. You would have thought that my nose would get in the way, but evidently not. And then there's diseases which affect the nerve locally, like if you have carpal tunnel syndrome, that can affect your hand. If you have other problems in the legs, especially, is where your balance will be affected. And finally, there's another one, poor body mechanics. We can call that operator error. In other words, you could have good balance, but you didn't do it right. So have you ever sat down into a chair and then kind of fallen half the way into the chair? Everybody raise their hand. Nobody's embarrassed about that, right? If you've done that. Yeah, I've done it. So the idea is, if you don't keep your balance on your feet until you sit down, you're going to fall into the chair. It's just a physics problem. When you're sitting in the chair, I'm going to show you. When you're sitting in the chair, your balance is on your posterior, right? So I have to sit down. Now, I'm not falling down because I am leaning forward and I'm making as much of my weight over here as over there, right? I've got weight here and weight there. If I were to just go vertical with my chest, I would fall. And if there were a chair there, I would fall into the chair. And since there's no chair there and I don't want to fall, I'm not going to do that. But when you're sitting in a chair, you shouldn't do that either. So keep that lean forward and your balance on your feet until you're sitting down. Then you can straighten up, and now your center of gravity is over your seat and not over your feet. The same thing works in reverse when you stand up. You have to keep that in mind. Have you ever tried, we're going to raise hands again. Nobody's embarrassed about this, right? Have you ever tried to get out of a chair? You get up, you get up, you get up, and finally on the 3rd or 4th try? That's because you didn't lean forward and put your weight over your feet. You're going to be standing on your feet, but right now, your center of gravity is, your center of mass is over your seat. So it's really just a question of technique in that case. Now, there are some people whose legs might not be strong enough, and that's a different condition. We're not talking about that. Other problems are inadequate oxygen to the brain. There are various problems that cause that. Sensory problems, such as, anybody been seasick? Nobody has to be embarrassed about that, right? And then there's a strange one called disembarking syndrome. They usually say it in French, though. I'm going to give it a try here. Mal de débarquement. Anybody speak French? How'd I do? Okay, so what happens there is you get seasick, sort of. You get the symptoms after you leave the boat. And unfortunately, that's kind of a hard problem to fix. Seasickness usually goes away on its own, but this one tends to linger. And sometimes you might need a physical therapist to help with that, but it's hard to help. Other illnesses can cause a problem. Even anxiety or psychological problems can cause dizziness. And finally, as we get older, how many are older? I'm going to raise my hand. Is there anybody younger in here? Ashley? Ashley, raise your hand. We got one young person in here. Wait a minute, Corey? Corey, raise your hand. So anyone our age then, dehydration, electrolyte imbalance, low blood sugar, that's at hypoglycemia, can start causing a problem. You may need to go to your doctor and get that addressed. And then quickly we're going to look at drugs, but not too closely. So a lot of drugs, as has been mentioned, can cause problems with dizziness, or their dosage can be a problem. And what I really want to say is, as we get older, that same water pill or that same blood pressure medication that we've been taking for years and works really well and we don't have any problem with it, as we get older, the side effects can be stronger. So we may need to tweak that a little bit. And if anyone has diabetes and you're taking insulin, that's something that has to be tweaked all the time. So sometimes drugs in general have to be tweaked in order not to cause side effects, including the possibility of dizziness. Things to do if you have dizziness or poor balance. See your doctor. See your physical therapist, your occupational therapist, or your speech-language pathologist, sometimes depending on just what your problem is, who you will go to. Stay in shape physically and mentally. It's very important, mentally. So read, do something fun, take Tai Chi, Do social dance. There's all kinds of things you can do to stay active. Just walking sometimes can be good. Use good posture and body mechanics and safe techniques. So we talked about one, right? We talked about just standing up and sitting down into a chair. If there are other activities that you do at home that you have a little problem with balance, maybe you should see a physical therapist and talk about body mechanics. Or if there are, other functional activities, you might want to see an occupational therapist. I have a patient now who's coming to me, but she says also that she has trouble with her thinking. And so she's actually going to a speech language pathologist for that as well. So let's speak a little bit more specifically about techniques to prevent falls. Stairs, ladders, and stools. Many of us at our age are starting to think about maybe we shouldn't be going on ladders and stools. And when we go on the stairs, we should always hold on to the handrail. And Deb talked a little bit about glasses. So if I have really heavy duty bifocals and I use that for reading, if I look down, I can't see out of those bifocals, okay? Well, let's take them off. The best way though is to go ahead and use that handrail and just go slow and be careful on the way down. Ice and snow, avoid it if you can. We'll talk a little bit about that in a moment. Into and out of a motor vehicle. How many people get in and out of a motor vehicle? How many people swing their legs out, put their feet on the tarmac, and press their legs against the lower edge of the car to stand up? Don't ever do that. Don't do that. So the problem is, if you're stepping out onto ice, your feet will just fly right out from under you, and you will fall down. You won't fall down with the full force of gravity because you will scrape the car with your backside and your back all the way down, and that probably won't feel good. And then you'll land on your tailbone, most likely, and that won't feel good. So you shouldn't get into that habit. And the problem is, even on the tarmac, with all the dust and stuff that's around, it can sometimes look like, oh, that's a corrugated surface, that's a rough surface, it's got a lot of friction, but actually a lot of times it is slippery. So you should do that same thing. You should ease your weight forward onto those feet and stand up using your posture and your balance. Any questions about that? And a physical therapist would be glad to help you. We talked a little bit about stairs, ladders, and stools. Use the rails if necessary, and look straight up or straight down, and with your body as well. Especially down. Some people get afraid of that edge if their balance is not so good. They think, okay, I'm going to be really careful. I am not going to put my toe over the edge. I'm not going to do it because my balance is iffy. So they turn their foot sideways. So most steps are not as deep as these steps. So really, I could have size 15 shoe and I would still fit on this step. But the regular stairway, especially for men, your foot doesn't fit on that step, and your toe goes over the edge, and it should go over the edge. The danger is not the toe of the next stair. The danger is the one that you're on right now, catching the heel there or catching the heel on the riser. And if you avoid that by taking a short step, you're trying to avoid the step down with your toe over the edge, you can catch your foot there, and if you turn your foot that way, I'm going to show you on this step, as you turn your foot that way and you lower yourself onto your other foot, you're torquing that knee. And if you have knee problems already, wait till you do that a few times. You're going to end up really hurting your knee. So you want to walk straight down. The only exception to that is if you're so insecure that you need to step one step at a time, and it's okay to do this. It's okay to take one step at a time. You're holding onto the handrail, which I don't have here. But you can turn towards the rail and go sideways like this. So you can do that. But you don't want to go diagonally down. So you don't want to turn diagonally and partially go down. Ladders. So how many people have given up ladders completely? No ladders ever. So, sometimes discretion is the better part of valor, and you need to just think about that. But traditional ladder use means you stay within the ladder. So if you climb up the ladder and the thing you want is on the shelf over there, you don't do that. You get down, you move the ladder over. I mean, it's common sense, but a lot of people avoid that. They think it's going to be quicker. And usually, after the hospital trip to the emergency room and recuperation time and like 50 visits to the physical therapist after the surgery, actually it wasn't that quick. Anyway, that's the risk. So don't reach outside the base of support and move slowly and carefully. The higher you go on a ladder, the more teeter-tottery it is. And ladders nowadays come with a little warning. Don't step on this step. They shouldn't even call it a step, right? They say, don't step on this step. Well, don't step on it. Stools, if you use a small footstool, make sure it's in good shape. Step in the center area, put your whole foot on the stool. And again, don't reach outside the base of the support. If you fall, it's going to be worse from the height of the stool. Way worse, surprisingly, a lot worse. And don't reach above eye level is a good goal as well. So if you have to reach up there, maybe you need to get help. So let's talk about not being on a stool and reaching up. So you can reach overhead a little bit if your balance is okay, but I'm going to show you a foot position. So just put one foot back a little bit and don't put the heel on the floor. So that gives you a little bit of balance. In case you reach up and you overbalance a little bit, you've got a little support back there and you can start over. Okay? And then when you're turning away, don't step back. Don't take that step backwards because that's pretty dangerous. Turn to the side, and even if I'm going over there, I'll turn and walk that way. So avoid walking backwards whenever you can. We have our eyes in front of us, our hands go out in front of us pretty easy, our knees bend forward. We have a lot of things that can help us out if we lose our balance a little bit going forward. None of that works very well backwards. We can reach back there very awkwardly. We can't really take a step backwards very well. So I can step forward pretty easily. If I'm falling, I can take a step. If I'm falling backwards, my heels are already digging into the floor. So I can't just move that foot back. I have to lift it up and forward and then put it back. And likely, by that time, I'm already about 45 degrees and a step is not going to help at that point. Into and out of a motor vehicle, we actually talked about already. So you can look at that real closely. And if you have more questions about that, so getting in and out of an SUV that's high or a pickup truck is a little different, and we do have ways of talking about that. Ice and snow we talked about. I do want to go into that just a little bit more. Avoid an incline. So an incline that's easy when it's not wet or snowy or icy can be really dangerous, especially with ice. So on the next slide, take slow, steady, small steps. And by steady, that means you don't want to speed up and you don't want to slow down fast. So I'm going to demonstrate that. So if I'm walking along and I have to stop, that much of a stop on ice can cause me to fall. By the same token, if I start out at a good pace, I can slip off of that foot. And in either case, it sometimes is the foot I'm putting forward that slips out from under me, but frequently it's the back one. As I push myself forward, that foot will slip back. So I want to go slow and steady, and any change I make, including a turn, should be slow and steady also. So it should be really slow, and notice my steps are small. And then when I start up again, I'm going to start slow, and I'm still not going to go very fast. Try not to carry anything. There are some add-on traction devices that you can use. They usually work better in snow, and they don't work at all usually on ice. But there's a good thing to do. If you're walkway is icy and you really have to go out somewhere, try walking on the grass where the snow is and it's not so icy. You'll have better luck there than on the ice. Avoid the ice at all costs. And there are other techniques you can use for that, but the best thing is, you know, turn on that gas fireplace and stay inside with a good book. What to do if you do fall? Before you try to get up, try to take stock of the situation and any injuries that you might have. I remember when I was a young boy, we went out as a group of young boys with one of the dads, as I recall, and we were out taking turns riding this motorcycle. So we were going up and down on a dirt trail. And there was this other guy riding his motorcycle, and he was like riding like a maniac. And he crashed. And so he was on the ground, and we were trying to help him a little bit. And all he could think about was his motorcycle. He was trying to get up. He was like bleeding all over and everything. And, you know, he was more concerned about his motorbike. But really, you need to take stock of yourself. And then you want to slowly get up. Now, getting up can be a problem, especially if one of your legs hurts or one of your arms hurts. And that's one of the things we do in physical therapy, too, is we teach how to get up from the floor if we're not as strong as we used to be, or how to avoid back injury when we're getting up and things like that. Be aware of any dizziness and be extra cautious. And maybe you need to rest there and somebody can help you. The next slide is some personal safety systems, and I'm not sure how up-to-date these phone numbers are, but definitely if you have questions, we can help you out with that. So you can go to basically any of the therapists at the Healthplex would be able to help you out with things like that. And sometimes you can look even in the phone book, or you can Google things. I'm still not used to that, Googling things. I don't know about you guys. All right. I'm now going to introduce Ashley, and she's going to talk about that concussion, one of those problems with hitting your head.
Hello. So, you've done everything right, but you fell. Okay, what can happen after that? Concussion is a very likely scenario for after a fall, and you don't actually have to have hit your head to get a concussion. I think that's a common misconception. The other thing is that you don't actually have to lose consciousness to have gotten a concussion. What is a concussion? A concussion is actually a mild form of a traumatic brain injury. And it can be caused by a bump or a blow to the head, or just a jostling of your head around inside your brain. It cannot be seen. So even if you get an MRI or a CAT scan done, concussions do not show up on those things because it is a chemical imbalance versus an actual brain in the bleed. So you go to your doctor and go get an MRI and, oh, you're fine. Your brain looks fine. Well, you could actually still have a concussion even though everything's looking okay. This is something to really be aware of if you were to fall. And that's why it's really important to make sure that you let someone know that you have fallen, because sometimes the signs and the symptoms won't show up right away. It could be a day, a couple of days, a week or two later, and you're starting to have some of these signs and symptoms that I'll talk about in just a minute, but you might not necessarily be aware of it. But someone in your environment might be thinking, well, what's going on? You're seeming a little off. And so if you haven't told anyone that you have fallen, they might not put two and two together, or you might not put two and two together. So it's really important to make sure that you do let someone know if you have fallen. Okay, yes. So what does a concussion look like? Sometimes it can be as simple as looking dazed and confused, kind of stunned. More confusion than, right after, and could be prolonged and just not quite sure what's going on or what happened. That confusion could be there. Forgetting instructions, moving around clumsily, not quite sure and steady of yourself, answering questions a little bit more slowly. Like I said, you don't necessarily have to have lost consciousness, but sometimes when you have a concussion, you'll lose consciousness, even just for a brief second or two. Showing different mood or behavior or personality changes. And as we're looking at a couple of these things that concussions can look like, I'm sure you're noticing that, well, those could be attributed to other things too. I know sometimes I get that dazed or that stunned look in my eyes when it's the end of a Friday, and I'm like, wait a second, what? So that could happen. But again, if you've let someone know that you've fallen, or oh yeah, I did fall, I wonder, could kind of help to put a piece to the puzzle. So making sure that you've told someone around you so that they can be aware also if they're noticing some changes in what you're doing. What does a concussion feel like? There are a whole host of symptoms that can come along with a concussion, and they can be on a wide range of the spectrum, from just, a little bit of dizziness or a little bit of nausea to, oh my goodness, I go to stand up and I'm feeling completely dizzy and nauseous and sick to my stomach. Being more tired could be a sign, because with a concussion, as I mentioned, it's a chemical imbalance, and so it's an energy deficiency is what's going on in your brain. So even more tired just doing simple tasks, just having a conversation. Dizziness, balance issues can happen. Having a hard time concentrating. If you're reading something, having a conversation, getting more forgetful than maybe typical. Just maybe not being able to process information as quickly as what you were doing prior to falling. Vision can be affected. Anything between having blurry double vision, being able to track and follow things in your environment, even reading can be more challenging. And so again, as you're looking at a lot of these things, they can be attributed to other things, aging, medications, all of those sorts of things. So being aware that, yeah, I fell, maybe that's what's affecting. And just not feeling right, or kind of having a hazy, foggy sense of what's going on, just feeling kind of out of it. Those can all be signs that you might have a concussion. So what do you do if you have a concussion? Give your brain some time to rest. Because like I mentioned, it's an energy imbalance. And so it's having to work harder to process and do the things that you would normally do. You're sucking that energy away. So give yourself time to rest. Naps and breaks are a good thing. I give you permission for it. It's good. It can kind of help to give you some more energy. Because your brain is trying to figure out what has happened, what's going on, and kind of fix that balance within itself. If you are going to be exercising, light exercising would be the key. Again, give yourself time to rest. Because if you don't do that and you keep pushing it, your brain is going to be giving your body signs and symptoms like nausea, headaches, blurry vision, dizziness. All of those things are a sign that you're pushing your brain too much. So time to rest is a good and very important thing. If those symptoms keep on happening, it is really important to notify your doctor. Most concussions, you could see signs or symptoms for up to 3 days. There is a small percentage of people who it can last for as long as weeks, if not months, if not longer. And so if you're noticing after a day or two that you're still just not doing quite right, go talk to your doctor, go let your doctor know, and then they can help to make the appropriate referrals to a speech therapist, a physical therapist, an occupational therapist, to kind of help with some of the retraining things that can be really helpful to help with that. And given that, just be aware of concussions. And again, you don't have to have lost consciousness to have a concussion. A minor fall can do just enough to jostle your brain around to cause some symptoms. So just be as aware as you can of that and let people know if you have fallen and if you're noticing any changes and what's going on. So, and with that, I'm going to turn it back over to Paul. He's going to be talking about other way, osteoporosis.
So, I think Ashley did a very good job of talking about repercussions of concussions, if you'll pardon my little alliteration there. Osteoporosis. Well, strictly speaking, osteoporosis, is that part of balance? Well, maybe not. Not unless you've really had a bad problem from osteoporosis. So your spinal vertebrae have actually fractured, or your femur has actually fractured, usually the head of the femur. That's the long leg bone that goes up into the hip. then your balance is going to be a lot worse, isn't it? But until then, if you have osteoporosis, how do you know that you have osteoporosis? Who knows how you know? Anybody know? Somebody, I heard somebody there in the lovely pink shirt back there say, you get a test, you get a DEXA scan. Because guess what? There's no overt symptoms until your bones have really been affected, until maybe the front of the vertebrae are crunched over and you're like this. Of course, there are other diseases and problems that can make you have that posture. But until then, you're fine, you feel fine, and you can be quite young and feel fine and have osteoporosis. Sometimes they use the term osteopenia, which is not quite so bad osteoporosis. But it's generally progressing. So if you have osteoporosis, you still want to be careful. And so this slide talks a little bit about normal T-scores and everything, but really you want to talk to your doctor about that. It's not so important that you remember those numbers as to remember if you're in the risk group, because we all want to stay fit, right? We talked about staying active and doing exercises, walking and stuff. There are certain kinds of exercises that we need to avoid. And I'll talk a little bit more about that later. So osteoporosis can increase the risk of serious injury from falls. Okay, so if it's not affecting your balance, it can still affect a problem from balance when you do fall, and now you have a worse injury than maybe somebody who didn't have osteoporosis. And if we look down to the third bullet there, it says about 1 in 2 women will get it. So, you know, this is a woman's disease, right? We men don't even have to worry about this, right? Oops, bullet number 4. 1 in 4 men will get it. That's half as many women if you consider that there's approximately the same number of men and women in the country, right? Well, that's still a lot of men. 25% of men, half as many men as women, that's still a lot of men can get this problem. And of course, the longer you live, the more likely it is that something like that's going to happen. And then here's the little kicker. Men are more likely than women to die within a year after breaking a hip. So maybe not as many men get it, but it might be a little more serious consequence for you. So that's an important thing to keep in mind as we get older. So what do? You do appropriate things such as medication, see your doctor, getting calcium and vitamin D, and any other mineral or supplement that your doctor might advise, and appropriate exercise. So, appropriate exercise. A lot of people hear that term weight when we talk about weight-bearing exercise, and they say, oh, I'm going to go lift weights. Well, that will probably help your arm and wrist if you should fall on it so that you might not break it. But the big danger is breaking the hip. This is bad, but breaking your hip is way worse, or breaking the bones in your spine is way worse. So the kind of weight-bearing exercise, I'm talking about bearing your body weight. So that means walking, or even going up and down stairs, or if you're able and your osteoporosis condition and your other medical conditions permit, then you can even do jogging or running. Again, balance plays an issue in that. So if your balance isn't the best as well, you might avoid some of those things, but be able to do others of them. Oh, and the last item down there, avoid spinal flexion. That is bending forward, especially under load. So if I drop my keys, what's the first thing that most people do? I'm not even going to do it all the way because I don't want to run the risk. So I'm going to support myself with my hand a little bit. Right? This is what we do, right? We bend over with our knees straight, and we reach right down to the floor. And some of us say, well, and that's because I can't bend my knees anyway. Well, that's really putting a lot of stress into your back. And in fact, in the worst way for osteoporosis. And here's the kicker. Even if you don't have osteoporosis, that's a good way to strain your back. You don't really want to do that either. So that's not the way to pick up things even as light as car keys. We're not talking about heavy things here. We're talking about the position is bad. So I'm going to pick it up a better way. So there are different ways. Actually, the best way is to get a reacher, right? Get a reacher. How many have a reacher? Good on you. So, but I'm going to do a different method. I'm going to put one foot beside the keys. And we have to keep in mind that this does require a little balance, because I'm going to put my other foot way behind me so that I can ease my knee down. And now, even though I'm lower, my hand doesn't reach the floor. So I'm going to have to lean forward a little bit, but I'm not going to round my back. I'm going to send my hips to the rear and come up, and then I'm going to look straight ahead. I'm not going to look down anymore, because when we look down, we tend to slump over. So I'm going to lift that knee and step up. And a physical therapist would be glad to help you with more instructions on that or other ways to avoid certain activities that can cause problems with osteoporosis or back strain. So I think I covered everything that I needed to cover on osteoporosis.